Sogoli, Ani, Wache, Kiakulamalsi, Kwekwe, Tanse. Hello, welcome. My name is Candice Burnett, and I'm the Manager of Indigenous Services at Western University. And in our tradition, it is a customary protocol to recognize and acknowledge the land upon which we work and find ourselves. London, as you all know, is located in the heart of southwestern Ontario, a territory that the Anishinaabe and the Haudenosaunee people have coexisted long before we became a country. We also recognize that this land was once the traditional territory of the Adoandrand, or the neutral people. Today, London is a vibrant community, and we are surrounded by 3 local First Nations, which are just about 20 minutes outside of London, which are the Chippewa of the Thames, the Munsee Delaware, and the Oneida Nation of the Thames. So I'd like to just acknowledge this land and First Nations people's longstanding relationship to this land, as well as the elders and the ancestors among us. Today's event is a partnership made possible by many organizations, which are probably too long for me to list right now. It is also part of a week-long event in our inaugural Indigenous Awareness Week at Western University. In Indigenous Services, we are really excited about this particular event because we're using storytelling as an approach to discuss important issues in the area of healthcare. Through an approach called narrative medicine, we've asked Indigenous people to share their experiences firsthand as patients. Storytelling is not new among Indigenous peoples. It's an integral part of our way of knowing. As Thomas King once said, the truth about stories is that's all that we are. So it's kind of fitting that we return to this practice of storytelling as a form of education. We also know that healthcare system is struggling to meet the needs of First Nations people. Just a couple weeks ago, the CBC released a report called First Peoples Second-Class Treatment by the Wellesley Institute, I believe, that showcased some of the disparities in Aboriginal and non-Aboriginal care. These are complex and challenging issues, but I am proud to stand here among all of you, a group willing to face these issues together. This is an exciting time, and I'm confident through the empathetic sense and medicine of stories that we can come to a common ground and find together a patient-centered approach in healthcare. Thank you.
So hello everybody, my name's Shannon Arntfield, and I'm an assistant professor in the Department of Obstetrics Gynecology at LHSC, and I'm going to be your moderator for tonight, as opposed to Jeff Nisker, who's been here in the past. So welcome to the 6th installment of Stories of Illness and Health, which is a public engagement series we've been running since 2012. The purpose of this event is severalfold. It is to listen and honor and learn from those who've experienced illness. It is to bear witness to suffering. It is to hopefully invoke healing relationships. It is to inspire change in the healthcare system. It is to develop partnerships. And it is ultimately geared at provoking and promoting humanistic, patient-centered care. We are thrilled to present tonight's event and thrilled to have been able to time it with Indigenous Awareness Week. And the focus of tonight's event is on Indigenous health and wellness. And we are incredibly fortunate to have 2 speakers tonight, Danielle Alcock and Brent Stonefish, to share their experiences of illness and caregiving. In following their stories, I'm going to invite all of us to participate in a period of engagement where we can ask questions and listen to each other and learn more. For anyone wanting more than that, there's refreshments outside, and we can have some coffee and refreshments later. I want to acknowledge that the experience of all this tonight may be challenging for some. It may be emotional for some. It may be uncomfortable. And the people hosting and organizing this event come with a great deal of humility. And I think the people coming to share their stories come with a great deal of courage, and I trust that all of you have come with a great deal of openness and respect to just share in what is being offered. Finally, I want to acknowledge the partnerships that make this event possible, and that includes the London Public Library, thank you to you guys, the Public Humanities of Western and Arts and Humanities, the Narrative Medicine Initiative at Western, the Schulich School of Medicine and Dentistry, and the Office of Patient Experience at London Health Sciences Centre. There's also some funding provided from the AMS Phoenix Project. So thank you to all the partners. And now, without further delay, I'd like to introduce Danielle Alcock, who's going to come and share her experiences. Danielle has just finished defending her master's thesis and is starting her PhD in anthropology, and we're just honored and delighted to have her with us.
Good evening. I would also like to acknowledge the traditional territories of the Chippewas of the Thames First Nation, Oneida Nation of the Thames, and Munsee Delaware Nation. Before I tell my story, it is important to share who I am. My name is Danielle, and I am mixed ancestry, with my mother's family being from Nova Scotia. On my dad's side, we are Anishinaabe from the Chippewas of Rama. Our nation is 90 minutes north of Toronto, located on the eastern shores of Lake Couchiching. I am honored to be here today, to have the opportunity to share my story with you. But this is not just my story, but a journey I've shared with my dad over the last 2 years. What is unique about our story is that we have been strangers to one another my entire life. My dad is an alcoholic who wasn't able to be a parent, so our relationship consisted of phone calls a few times a year and visits when I had the courage to see him. To be honest, as a daughter of an alcoholic, I've always been waiting for that phone call, that call to tell me that he's passed away. But in September 2013, our lives became entwined. My dad was unable to walk and was hospitalized to figure out the cause. They diagnosed him with alcohol dementia and alcohol neuropathy at the age of 56. Alcohol dementia is produced by long-term heavy drinking that directly damages brain cells or causes health problems that produce brain damage. Treatment requires sobriety, vitamin replacement, correction of medical problems, and management of behavioral problems. My dad still has long-term memory, but his short-term memory requires constantly reminding him of daily routines, names, and dates. The difficulty walking was nerve damage as a result of nutritional deficiencies, so his brain doesn't communicate with his legs as well as they used to. So he uses a walker to help him get around. With my dad's diagnosis being complicated, since it wasn't just dementia, but physical disabilities and addiction, no one in the family could cope with dealing with her grief and the responsibility to try to find support services. So I stepped up. What scared me more than knowing the long health journey we had ahead of us was dealing with my own emotions of caring for someone who I've never known. Especially since being a caregiver at my age is really lonely. My entire life has been changed so much, and I don't know anyone who can relate. I feel guilty for even talking about how hard it can be, because with my dad, it's a long mourning process. It's watching him slip away more and more. For me, it's mourning the loss of elements of my life, like spontaneity and only being responsible for myself. Now, every decision I make, whether it's traveling, applying for jobs, or planning my future, I have to do what's best for my dad, and sometimes that means putting on hold the things I want to do. There are supports for caregivers of loved ones diagnosed with dementia and support groups for someone whose alcoholism affects your life. But it's exhausting and takes up precious time trying to attend all these different support groups, which only adds more stress. I wish support services existed that were culturally safe, along with dealing with the complexity of alcohol dementia, so there could be a safe space to share with other Indigenous caregivers who might be experiencing some of the same things. But I know for me, and probably for anyone else looking after a loved one who has addictions, I've been too scared to talk about it because of the stigma and having to defend my dad against judgment. When trying to sit down and tell our journey, as we try to cope with this difficult illness, I struggled to tell the story in a way that wouldn't contribute to stereotypes about addictions for First Nations peoples. I want to convey the complexity of who my dad is as a person, and that he's more than his illness. The fear of judgment and the stigma of alcohol dementia has been present within most of our interactions with health providers. When I became his caregiver, I thought my role would be looking after him, but I realized I also had to become his advocate. Dealing with many doctors, nurses, and social workers, as soon as they heard First Nations and alcoholism, they treated him so differently and focused on chastising him for his addictions and not viewing him as a person anymore. The worst interaction was when we went for an appointment with a neurologist. I had driven to Rama from London, which is a 3.5-hour drive on a good day, and that appointment lasted 15 minutes. He had not read the medical chart before we arrived, so he sat at his computer, read the file, and didn't even make eye contact with my dad. The doctor didn't allow my dad to tell his story and understanding of his illness. Instead, the minimal conversation with the doctor consisted of him scolding my dad and repeatedly telling him, "This is what happens when you drink your whole life, and now you have to live with the consequences." The reason this event stuck with me was the way it made me feel afterwards. I felt angry, hopeless, and scared. As a caregiver, witnessing the way my dad was treated made me have no trust in that doctor, and I never took him back. Since the neurologist was judging instead of listening, I did not trust that he would provide the best care possible for my dad. I worried the judgment we experienced, that the doctor viewed him as someone who didn't need empathy or understanding, but a lecture on his bad life choices. After countless interactions with health professionals, I realized they could not wrap their heads around why someone would choose to destroy their bodies using alcohol. They always focused on him needing to be stronger, to have more willpower to quit, and that if he doesn't take control of his life, it will be his own fault. The focus is always on his choice to make a change. What they don't understand or take the time to listen to him is that throughout his life, he's had minimal choices and has dealt with insurmountable loss and grief. In order to understand my dad's life and my own, our story connects across 3 generations, beginning with my grandma. My grandma, who will be 91 next month, is the strongest person I know. My grandmother's life was directly affected by colonialism. She was forced to attend residential school and face violence and racism because she's an Indigenous woman. Uprooting and displacement from her community, losing her Indian status because she married a non-Indigenous man, and losing children to addictions, and because of the 60s scoop, shaped her life. As an Anishinaabe man, my dad grew up with the intergenerational effects of my grandmother attending residential school. My dad grew up in Toronto, disconnected from his community, language, and culture. Doctors who judge my dad for his addictions have no understanding of the impacts of intergenerational trauma, the loss he has faced, along with coping with racism and a lack of opportunities. If doctors took the time to sit and talk with my dad, they would learn that he is forthright about his alcoholism and that he's used drinking as a way to numb himself and to block out negative memories that are too overwhelming to feel. Now that my dad can no longer heavily drink, all the memories he's fought so hard to forget cannot be kept at bay. A lot of our time together, we talk about his life and the memories he now has to feel since he can't numb himself with alcohol. The most difficult traumas within my dad's life was a continuous fracturing of his family. This is always a hard part. Before my dad was 26, my age, he lost 5 siblings. and my grandma lost 5 sons. My Uncle Murray was taken away during the 60s scoop, when children were removed from their families and adopted by non-Indigenous families. To this day, no one knows what happened to Murray. My dad's 2 older brothers were kidnapped by their father, and they were reunited 50 years later. But the most difficult trauma for my dad was losing 2 brothers to addictions. My Uncle Shannon was addicted to huffing nail polish remover and died in his early 20s. And my Uncle Alan, who my dad was the closest to, was drunk while trying to cross the Don Valley Parkway in Toronto and was hit by a car. My dad's stories about his relationship with his brothers and their lives ending so young has helped me to better understand his addiction. With the continuous loss of siblings, no one in the family talked about it or dealt with her grief, thus carrying a burden of sadness that I could not fathom. I have to reiterate again that our health journey is not representative of all First Nations peoples. I just wish that some of the healthcare professionals we interacted with had knowledge about the long-lasting impacts of colonialism, a cultural understanding, and that my dad is not just an illness that you diagnose and move on from. He has a complicated history and deserves to be treated with respect, understanding, and empathy, because with my dad's diagnosis, there's a lot of uncertainty for his future. I tried to research endlessly, but only found medical studies and nothing focused on alcohol dementia or even dementia that affects First Nations families. Unfortunately, healthcare providers can't give any insight to his long-term health, so we're told to wait and see what happens. When dealing with doctors who judge my dad and spend most of the time focused on his lack of willpower and why he made bad, unhealthy life choices, it makes coping so much more difficult when you don't feel supported. If you take anything away from today, I hope it's the understanding of the importance of bedside manner. Taking the time to listen, explain the medical terms in a way that's easy for my dad to understand and free from judgment can create trust and feeling of support instead of fear and worry about the level of care that you're going to provide. Through spending time with my dad, I've learned the importance of being humble and listening. I've gained empathy for my dad and why he used alcohol to numb himself to try to forget painful memories. What has made our journey so far a lot easier have been the healthcare providers we've met who went above and beyond. The caseworker, who I'll call Sarah, was assigned to my dad, had a background in addictions, and tried to find services to deal with the physical and behavioral issues. Although no services existed, she ensured that there were personal support workers from RAMA and kept in contact with me every few days. Although she was unable to find services for alcohol dementia, communicating with me often and providing information about potential avenues for finding care eased the anxiety and stress of the situation because I felt supported. Frequent conversations to keep me updated on the services that were being provided for my dad created trust between the caseworker and myself because she understood the complexity of the situation. Sarah's support was crucial during the pivotal moment leading to our lives becoming entwined and me becoming my dad's sole caregiver. Last March, I got a panicked phone call from my dad's partner. She came home from work and he was missing. Since he can't walk, he had taken her electric scooter. Being in London, there was nothing I could do but to contact the Rama police while she tried to track him down. We are lucky that it was good weather and that he hadn't gotten far. He was trying to get to a bar since he's no longer allowed to drink and he couldn't remember how to find his way back home. Since he only had 2 hours of care per day, it was dangerous for him to be left on his own. We really wanted to keep him at home as long as we could, but we couldn't afford to hire full-time care, and the Rama Health Center didn't have the funds or manpower to increase help in the home. He needed to be moved to a long-term care home immediately to have full-time support. Since the waitlist to be moved to a long-term care home in Aurelia, which is the closest city only 15 minutes away from Rama, was several months, we were running out of options. Sarah looked into the waitlist for London, and it would be much faster. So I had 48 hours to decide. At this point, I was just thinking about trying to get him placed as soon as possible to keep him safe and healthy. It didn't hit me until later how much our lives would transform. It was really hard for my dad to be moved to London since it's far away from his family, community, and long-term partner. I feel guilty that we as a family don't have the finances to keep him at home. And since the Rama Health Center just doesn't have the funds and resources to deal with the complexity of my dad's illness, we had to move him to London. With moving my dad to London, we had to be referred to a new neurologist. Going into the appointment, I was mentally prepared to defend my dad and knew which questions were going to be directed at me since my dad is rarely asked. But this time, it was different. When we entered his office, he asked me to sit in a chair further away and that he would talk to my dad first. He sat facing my dad and just talked with him, asked him about where he was from, how he was doing, and asked him about his health. I was happy to be witnessing a wonderful interaction. After speaking with my dad, the doctor asked him permission if I could answer some questions about his health. It was great that the doctor spoke with him and there was no judgment. So I'm gonna play just a really quick clip of my dad talking about his illness because it's his understanding of it. So what do you think you have?
Poison from my knees went to my head. That's all I think it is. They say don't fall down. I fall down all the time. But if they could prove it either which way, I'd like to hear.
When my dad has spoken to doctors, they don't listen to his explanations and focus on correcting him about his diagnosis. What this positive doctor interaction showed was that it doesn't matter if my dad thinks that his memory is affected from poison in his knees. It's his understanding of it, and listening to him and focusing on him as a person should be more important. This neurologist just went with my dad's understanding, and I could see my dad physically relax and not feel confused, and I was able to answer the medical questions. The way this neurologist treated my dad put me at ease because he was able to tell his story of illness and to ask questions. This doctor is an example of not continuing colonial relationships in health with First Nations individuals and their families because the interaction wasn't based on stereotypes and unequal patient-doctor dynamics. What also separated this doctor from most of our bad experiences was something he did at the end of the appointment. He simply asked me how I was doing. Strangely enough, few healthcare providers have asked me this question throughout our journey so far. Just asking made me feel a moment of relief. He didn't just focus on the diagnosis and discussing the medical aspects of it. He focused on my dad and as a whole, including me, his family, and his caregiver. Before we left, he made sure to tell me that I need to look after myself as well. Just asking me how I was doing made me feel better and was an important reminder that I need to look after myself. I have to try to take care of myself as a whole because I can't afford to take time off. As a caregiver, it's easy to dedicate everything I have to that role, but I need to set aside time for the things I love to do and time to relax because I don't want to become a hidden patient. The stress associated with trying to organize different services, planning for my dad's short-term and long-term health, and dealing with my own emotions with a diagnosis, my health has been affected. But accessing cultural services through counseling has helped with the turmoil, and I'm using traditional healing in order to deal with my emotions towards my dad for being an absent parent and for becoming his caregiver. Traditional healing is also a way to approach my health holistically and to have a safe space to talk about how my dad's illness has affected my life. Although becoming a caregiver for my dad has been difficult, I am honored and fortunate to have the chance to get to know my dad and my grandma since we visit Rama more often now and have great relationships with each of them. They are both strong and resilient to be able to continue after so much loss and trauma in their lives. Most of the time spent with my dad is focused on telling me stories about his life and what he can remember about his past. I'm not only my dad's caregiver and his advocate, but most importantly, I am his memory. What he can't remember from his past, I can fill in and provide the details about the present. I've learned that my dad is someone who is sweet, kind, and extremely witty, and even though he can't remember most of our visits, and eventually will forget who I am lucky to have a second chance to get to know my dad, who is no longer a stranger. Thank you.
I actually just want to take a minute to just hold Danielle's story just for a second, and then we'll introduce our next speaker. Danielle, I really want to thank you for sharing. Thank you for listening, and we found it easier to do questions after both speakers. So even though I know many of you have things that you may want to engage with Danielle about, we're going to save the questions until after Brent. Brent Stonefish is our second speaker, and he is from the Lenape Nation of Moravian Town. I'd like to introduce him now.
It's the first time that I've actually used my iPad for my notes, so bear with me. Just hope it doesn't die on me. Okay. Quinganao lomwa, ni de shinjili poa kokus, ni de langamok de kwach lenapel. My name is Brent Stonefish, and I'm of the Turtle Clan of the Lenape Nation at Moravian Town. At this time, I'd like to acknowledge our relatives upstream from where I come from at Chippewas of the Thames, Munsee Delaware Nation, and the Oneidas of the Thames. Just that they lived upstream, so we make sure we don't say anything bad about them, because who knows what they're going to throw in the river. So, but I acknowledge their territory, and I thank you for allowing me to be here in London to tell my story. I'd just also like to acknowledge Danielle. I can be quite an emotional person, and to follow that is like, oh my God. It's like, I really appreciate and honor your story. So I say Anishik, or Chwata Anishik, as we say, a big thank you in Lenape. The reason that I introduced myself in Lenape is to, it's not only just to acknowledge the language of my people, but to acknowledge the ancestors that come into the room with me, that those unseen forces that help us and guide our words, and to connect with the spirit and to the ancestors that you bring with you into this room as we share our stories here. And it's to give us place, it's to acknowledge place and space, and that we are a part of creation, and we are a part of a larger family. My story begins with my mother. My mother, who in our language, her name was Kakapish, which means butterfly. My mother has been gone for just over 2 years now. She passed away 2 years ago, February 15th of 2013. And our story begins with the whole idea of being a patient advocate. In a lot of ways, I was her patient advocate. I'm her middle child. There's 3 of us. I have an older brother and a younger brother. And my mother, she would have been 63 at the time that she passed. And one of the things that about her care is that she was in renal care. for 4.5 years before she died. So our story begins, and I say our story because it's her story as well, is the night me and her went to bingo. She loved bingo. We used to go all the time. And me and my wife would take turns taking her to bingo. And on this particular night, we were at bingo, and she was feeling sore, and she was in great pain. And one of the things that we knew about my mother is that she had a high pain threshold. And then we were halfway through the program, and she hadn't won yet. So she wanted to stay till the jackpot round. But if anybody knew my mother, she was a hardcore bingo player, and she enjoyed it so much. And one of the things that where our story is that she was too much in pain to be there anymore. And at intermission, we had to call an ambulance, and they had to take her to the hospital. And so we ended up at the hospital. I called my wife, and she came to the hospital, and she was in pain all night, and so they tried to make her as comfortable as possible. And the next day they had told her that her kidneys had failed, that her kidneys had shut right down, that they were only functioning at 2%. And that she would have to make a choice whether she would go on dialysis, or she would choose to go into palliative care. And one of the things that this was a choice that she had to make. And one of the things that our story rewinds again when we talk about my mother is that for a lot of her life, choice wasn't an option for her. She was never given choice. From the time that she was a child, her mother was very abusive to her, and then she went into an abusive relationship with my father, and she always felt that she didn't have choice, that she always had to do for others, and so she had a history of violence in her life, that she was always at the receiving end of that violence. So she had left my father in 1996 for the final time, and she had ended up in Peterborough. And that's when she took her life back. That's when she took her life back, and she owned who she was as Kakapish, as that butterfly. And one of the things that when she made that decision, that she found that strength to leave that relationship. She took back her life, and she was a championship hoop dancer in her teens. And then, because she had left that abusive relationship, she was allowed to dance again. So she started dancing jingle dress, and she started reclaiming that part of her culture. And telling stories and sharing stories with myself and my children. And she gave voice to me, and she gave voice to many women in our life and around her. She was lucky. She was able to take back that life. And she was able to celebrate life, and she was able to dance, and she was able to sing, and she was able to share the strength of that Lenape culture and that Anishinaabe culture. And that day when she had to make that choice, the doctor came to her and said, "You need to make a choice. We need to put a stint in. We need to put that line in for you to go to dialysis. Or you need to get your affairs in order. And everything happened so quick. And next thing I know, they said, okay, she's got to go to surgery. So she goes to surgery. I went home, spent some time with my kids, and I came back and I went into the recovery room where she was laying. And she said, look at this. And I said, what? And she says, they put that line in. And I said, did you make that decision? And she said, no, I did not make that decision. And those feelings of violence came back to her. Those feelings, nobody signed off on them putting that line in. I didn't sign it, she didn't sign it. After it was over, they came in and said, oh, you forgot to sign this. And not knowing what was going on, she signed it after the fact. So we had a huge discussion, and I knew then that I had to become her advocate, that she wasn't in a space anymore that she could speak for herself all the time. And so we went through many emotions, and we had to share that story over and over again about the violence that she went through. And fortunately, we were able to meet many wonderful people, the social workers in the hospital. The one woman was amazing, and she listened to my mother, and she talked with my mother, and she talked with us, and she made it okay. She made it okay, and we made it okay that this happened to her, that we had sat in prayer with our family, and we sat within our culture, and looking at our culture and looking at that phrase, everything happens for a reason. And we accepted that Creator or her ancestors or her spirit helpers made that decision for her, that they give her extra time to be here with us. So for the next 4.5 years, she was able to teach my children stuff. She was able to be a grandmother. She was able to be my mother. She was able to be a mother-in-law. She was able to be an auntie. She was able to be those different things. And we seen her struggle for the next 4.5 years. We seen her, struggle with dialysis, spending 3 days every other day of her life so that she could live on that borrowed time, on that artificial life preserve of dialysis. And it was many times I had to be that advocate, many times that I had to speak on her behalf and to be there, to be that strength for her. As she showed me the strength of being there, of not just surviving, but of being an awesome, awesome person and an awesome woman. So as we went through that, I learned that we need to speak about us. We need to speak as Indigenous people. We need to continue to tell our stories when we are in care, when we are in health care. And we need to reiterate to those health professionals that even though you might not see color, or even though you might say that you are not racist, there is still difference between us, between our cultures. That a friend of mine, she had recently posted on my Facebook, I had asked a question, and she said, all people see each other through the prism of their own birth culture. A person not raised in an Indigenous culture will have difficulties trying for an authentic interpretation because their perception is measured through the prism of their own cultural ways. And that's one of the things that our healthcare professionals must realize, is that whether you're Indigenous or if you're Irish or if you're an immigrant to this country, we all have a birth culture and we all have different perceptions. As an Indigenous people, we see ourselves based on our life story. For Indigenous peoples, this includes our collective experience, rooted in oppression, racism, family violence, love, family connection, and connection to home and connection to creation. It's not all negative, and that's one thing that we recognize, that our cultures are rich, and our cultures teach us much about being. And when we enter into those healthcare systems, we need our voices to be heard. We need our voices, our stories to be understood. That when I became the patient, when I came down with necrotizing fasciitis, I had to go into the hospital, and being there, my wife had to be with our children. So I was left to be my own advocate. And at one of those points, I had to go in, and they had to put an IV in me, and they took 7 tries to get it in. And so if you can imagine, after the 5th time, you're damn well ready to punch somebody out. and it traumatized me. So when I had to go back in when it came back 3 months later, I had to go in, and I says, okay, I'm traumatized by IV drugs, so you need to be patient with me. And she said, oh, why? Have you used IV drugs recreationally? And knowing the experience and learning the experience from my mother, and knowing that they're coming from a place of other, I said, no, I do not use drugs or alcohol. I says, I've seen drugs and alcohol rip families apart, so I haven't touched drugs or alcohol since I was 19. And she says, well, that's too bad. So you had a problem with them. And I said, no, I didn't. I did not have a problem with them. And I had to explain to her, and she couldn't get it. And I says, please just help me. I says, I'm letting you know that I'm traumatized by IV use. Please just help me do this, and be as compassionate as possible. And she didn't get it. So I grinned and bared it, and I got through it. And I made sure that I told the doctor what had happened. And it was one of those things where I was proud of myself for being that advocate for myself. And I always make sure that I tell my story every time I go into Emerge, or if I end up in the hospital, because just recently I ended up in the hospital because of a herniation of my discs in my back, and I ended up in the hospital, and the nurse came, and she says, what are you taking? So I told her what I was taking, and she says, well, the doctor prescribed this. This is what we're going to do. She says, and I told her again, told this nurse, I'm traumatized by IV. I know you're going to put an IV in me. Please be compassionate. And she said, okay. And so every step of the way, she told me what she was doing, why they were doing it, asking me, coming back and seeing if I was all right. And, once they got that drug into me, and 10 minutes later, felt like I could do cartwheels. And she says, you're all right to go? And I says, yeah, I'm okay to go. And then I looked at her and I says, thank you for being so kind and compassionate. And she looked at me and she said, "You're welcome." And then she walked away, and that was our interaction with each other. One of the things that my mother has taught me is that the 4 basic values of kindness, honesty, sharing, caring, faith, and strength. Kindness is about, first and foremost, is about being kind to yourself. And sometimes when it comes to healthcare professionals, you need to be kind to yourself and let them know what your story is. You need to let them know what traumatizes you. You need to be kind to yourself, because if you're not kind to yourself, you can't be kind to others. Honesty, being honest with yourself and saying, no, I honestly believe that you're not being kind to me. Letting those healthcare professionals need to let them know how you're feeling. If you're in pain, you're in pain, and let them know what that pain is. Faith, sharing and caring, always sharing your story like we are tonight. And faith and strength. Have faith and have the strength in yourself, and have faith in whatever it is that you believe in. And if you have these 4 basic values, that fosters respect. Respect for yourself and respect for everybody around you. And those are the 4 basic values that my mother taught me through this journey that we had together of being a patient advocate and being a patient myself. And one of the things that we've always believe in our Lenape culture is that everything begins and ends with creation. If we have those 4 basic values in creation, which we are all a part of, then we can move mountains. And I have faith that as we continue to tell our stories like this in these forums about healthcare and about how we need to work together, then we can actually move mountains, and creation will be ever so grateful for whatever we do. Nishik.
I think similar to Danielle, I'm just going to ask that we sit with ourselves and our own thoughts for a minute and hold Brent's story. So I want to thank Brent Stonefish, and I want to thank Danielle Alcock for sharing. And I'd like to give them another thank you together as a group. And I'd like to open it up for a time of questions. And I think Brent's 4 tenets from his mother about kindness and honesty and sharing and faith are actually a great platform to ask our questions and to engage with one another. So I'm going to sit down at the table. We have mics, and there are mics down here. I would ask that you could just identify yourself if you have a comment or a question. Wait till a mic comes over to you. And if someone forgets and doesn't wait, I will repeat the question, because those in the back will not be able to hear those in the front. So we'll open it up to anybody who'd like to engage.
Hello, can you hear me? Okay. My name is Shirley, and I'd like to ask Brent a question. Just wondering if your mom was traditional or Christian, or what, did she have a mixed background?
She was actually traditional. But not saying that, her mother went to Lutheran church as well. So her mother was a very big advocate on cross-cultural relationships, but my mother held a lot of traditional teachings as well. So.
While you guys are thinking, I'll ask a question. Which is, I think there are enough people in the audience that are young enough to not actually know what the 60s scoop and residential schools were, and I just wonder if you can elaborate on those pieces, or anybody.
Well, we both can, I suppose. Okay. Okay, so I guess to try to wrap my head around giving a summary of residential school in the 60s scoop is that they're part of the colonial process. What it was really about was trying to take away people's identity, their culture, take them away from their families and their communities. And that's really what it was. It's a tool of assimilation where you take children, which are the next generation, you take them away and you send them to a school far away, or you take them away from their families because somebody decides that they shouldn't be a part of that culture, they shouldn't be with their families, and assimilation is really what it was, and unfortunately it does pass on to the next generation. If you have family members who attended residential school or were a part of the 60s scoop, because you grow up without those members of your family. And that's something that you can never get back, and I could never personally understand it, of what my own family has gone through. I can just feel it and try to empathize of what that was like.
I'm my memory banks here, trying to remember some of the particulars about the residential school system. Was a system that was designed to take the children out of the community. The best way that they had figured, that the Canadian government had figured, was in order to kill the Indian in the child, and that was actually a quote by one of the superintendents, to kill the Indian in the child, was to take them from their communities. And the last residential school to close in Canada was 1996. So the whole idea was to take them, teach them Christian values, teach them European ways, and to send them back home, so that way eventually they would be absorbed back into the Canadian body. And then one of the things that had happened is that they were never taught about love and nurturing and caregiving. So when those children came back to their communities, the shame of the parents put a gap in between them. And then when they had their children, they didn't have those 4 basic values to raise their children, so they had nothing to go on. So the cycle of violence continued, and which went on to the 60s scoop, where the Children's Aid Society came into the communities and said, you're not fit to be a parent, you're not fit to be a parent, so we're taking your children. But the reason they weren't fit to be parents is because they were the ones that went to residential school. So that cycle of violence continued. And the unfortunate part is that, the 60s scoop happened during the 50s, 60s, and 70s. But there are more children in care, First Nations children in care today, than at the height of the 60s scoop and at the height of residential school system. So it continues for First Nations people today. And that's part of that collective experience for First Nation, Inuit, and Métis people.
Just like to emphasize the impact of the residential school on Indigenous people, and really underscore that with the uprooting and displacement that occurred to children, and the loss in the family, the impact on the family and the impact on the child, and also the abuse that happened in the residential schools, which created a generation that has had to find its way back and find healing, which we've tried to do in our communities through our traditional practices. But it's a whole generation that was impacted so terribly in terms of losing their place, losing their homes and their culture, and then having been abused. So we really have to give credit to our communities that have moved forward and tried to create and have created healing spaces, and the impact on the next generation. So I just wanted to say that there is resilience in our communities, and we're moving forward. Hey, hey.
Hi, I'm Rochelle Wood. I'm with Patient Experience at London Health Sciences Centre. Danielle, to both of you actually, thank you so much for speaking. And Danielle, I'm going to direct my question to you, but welcome a response from both of you as well. You spoke a great deal about going to visit various physicians or healthcare providers and how your father seemed to be largely ignored and most of the conversation was directed at you. Did you ever try in any of those circumstances to, and it's very difficult to speak up no matter how strong any of us are, but to kind of speak up and say, you know, please ask my father or please include my father? Or was there any follow-up post appointments? Because we're always interested in how to make a patient experience better. And I know you spoke about bedside manner and things like that, but just wondering if in the moment you felt strong enough or confident enough really to speak up.
I would try to direct them back to speaking with my dad in terms of I just wouldn't answer. And I'd be like, ask him. And he would be there and he'd give his response. But because it wasn't, he doesn't understand that he has alcohol dementia or alcohol neuropathy, that he can't walk. So when he's talking with healthcare providers and gives his understanding, they just focus on telling him, no, this is your diagnosis, and that's it. And so for him, he just doesn't understand. And so instead of focus on interacting with him and making him feel comfortable, and you can still ask him questions, he can still answer, I can fill in the rest. But another big part of it is the power dynamics with experts and specialists, is that when you sit down with them, you're not the person, they're the expert. So they're the ones who are going to tell you what's wrong, what you need to do, where to go forward. And you really feel so hopeless because you're interacting with someone who's not treating your parent and my dad like a person. And so that's something that I think doctors really need to try to focus on. It doesn't matter what his understanding is, just speak with him. Be humble and listen. Listening was the biggest aspect of it. But they need to also recognize there's a power dynamic between the patient and a doctor. And that patient going in, as well as the caregiver, is you're scared if you question them that they're not going to give you very good care as well. Because if you're asking them those questions, then maybe they just won't care as much or won't want to, give you more opportunities in terms of services or for going for any testing and diagnosis. So it's pretty complicated, but it's really just listening. That was the most important thing.
Hi. This question is for both of the speakers. The pain of witnessing a culture, especially one's own culture, is being wiped out. I know this is a pain that I cannot fully understand or grasp. And the degree of this pain is manifested, in my understanding, I think, in alcoholism or in drug abuse or various kinds of other things. Could you say something to make me fully understand this pain? Because, I mean, I understand it, I can rationalize it, but still it stays on the surface.
The speaker is going to take a moment to think. So we're just talking about making sure we're understanding that we're understanding the question the way you phrased it. I think what I hear you saying, what I hear being asked is, it's challenging to understand the loss that either the loss of your culture or addiction or, for that matter, dementia may bring. And for those of us not involved or not acutely experiencing those things ourselves, the understanding can stay somewhat superficial. And I think what I hear you asking the speakers is a way of helping the understanding become deeper for you. Is that a correct way of understanding your question? A way of understanding it more deeply? I think that's what I heard asked.
I guess I was asking if there is a way to actually be able to feel the pain. And I believe all the pain results from witnessing and also experiencing one's own culture being wiped out. And perhaps I'm not speaking about medical conditions specifically. But it's all right. I guess, yeah.
Okay, let me take a stab at this one. One of the things that when I start talking, I had introduced myself and I said, Nida Shinji Lipua Kokus. So my name is Lipua Kokus, which is Wise Owl. Nida Langamak de Kwach Lenapel. I am of the Turtle Clan of the Lenape. And that is essentially, I'm addressing creation. Because without my connection to creation, I feel, and I'm speaking for myself, I feel a loss of purpose. I feel a loss of what is my human experience. If I don't understand my purpose, which is rooted in my spirit name, Lipua Kokus, if I don't understand that, then I will make my way through the world wandering and wondering about what it is I'm here. Am I here to suffer? You know, what is it, you know, why did I experience loss? Why did I experience being, you know, watching my mother go through her pain for 4.5 years? You know, was it just because? You know, was it just because somebody thought that I should? You know, for kicks and giggles? But it's that knowing that our culture is so deeply entrenched within creation, and if we don't have that connection to creation, then we don't have purpose going forward. And our culture and our belief system of creation is rooted in our language, is rooted in our ceremonies, is rooted into the way we utilized everything in creation, from the animals to the trees, to the rocks, to the sands, the soils, to all of that. And when that was taken away, that was very painful, because our purpose was taken away. Our sense of being was taken away. And you walk around in grief constantly if you don't have purpose. And that's why I believe, personally, I don't speak by any means for all Indigenous people, but through my experience, that is why we continue to resurrect or to revitalize our culture. And that's not just by going to see our elders, it's by sitting with creation and asking them for that help in whatever capacity that may be: fasting, sweat lodge, meditation, daydreaming, whatever you call it.
Thank you. That's a wonderful answer.
Hi, my name is Tavis, and I have a question for over here, both Danielle and I've forgotten Brent. Yeah. I don't want to generalize, so correct me when I go astray, but it seemed like in both of your stories, the idea of choice was really important. That in many occasions for both of you and for your parents, choice had been taken away in different times. And I think choice is something we struggle with, that all people struggle with. So I wanted to ask if there was some part about some part of First Nations culture and the idea of choice that you could help medical professionals to understand, whether there was anything specific that First Nations people used to work with the idea of choice, or anything along those lines that might help us to provide information.
It's a really good question, because you bringing up in terms of choice, and I guess with medical professionals, it's always the idea that, like, you have so many choices, why don't you just do it? But they don't understand that there's so many other things connected to it. So, like, I'll just kind of speak to our stories. My dad didn't have the chance to go to school. That wasn't an option. He grew up in poverty and in violence. He had no connection to his culture, which is, I absolutely love that Brent brought that up, is you have no purpose. And that's the root of him, is he had no purpose. He didn't know who he was. And so you keep going and you try to find ways to deal with your pain and that loss. So I think with the element of choice is that it's just a recognition that not everybody has the same options, and that you have to be aware of that different lives have different choices, and it's not always that simple.
One of the things that I've failed to mention in my story was that when my mother had her choice taken away from her and that line was put in, she made the best of what was given to her. And one of the things that, excuse my crudeness, but one of the things that she would always laugh and say was that sometimes you have the choice between shit and shit, and you take the less smelly one. And she would laugh, right? And one of the things that was very pivotal in her journey when she finally passed away was that after 4.5 years, she was going to dialysis 3 days a week, so Monday, Wednesday, Friday. After 4.5 years, the dialysis started to fail. So they wanted to add another day for her to go on dialysis. And she had chronic water in her lungs, and so they wanted to beef it up to another day a week. And she looked at me and she said, no. And she says, I'm done. She says, I've been here 4.5 extra years. I need to take my life back. And so she made that choice to stop dialysis. And I said, okay, you made that choice. I'm supporting your choice. Let's go. And for the next 10 days, she was free. And she lasted 10 days after once she made that choice. And she made the best of that. And so, sometimes it's between shit and shit. And I'm going to leave it at that.
Hi, my name's Erica. I have a question for either of you. I was just curious, you both sort of talked about how your parents' narratives of their own illness or their stories of their own illness was sort of oftentimes just sort of erased through the medical narrative that the doctors wanted them to believe, right? And then I guess I was just curious if there was any particular moments that you remember where maybe there were aspects of the illness or descriptions of the illness that seemed to be lost in the way that the doctors would articulate it, and does that make sense? So because I'm just curious if you ever had any moments where, because it seems that there's this lack of communication that's going on in some sense, and really having a doctor understand the particularities of an illness and what gets lost when it's talked about in the medicalizing way that it is. And I was just curious if there was any times where that seemed to be prominent, or if that reflects any of your experience. If not, that's okay too.
Especially with the neurologist that we met, he was so wonderful because it was just talking, and my dad got to tell his story. And so with that, he was able to say this, I can't remember. And he'll tell him, I can't remember what happened yesterday. And so the doctor would be like, all right, well, tell me more about that. So it's having the chance that even in just that moment, he's not going to remember, hours later, but in that moment, he feels heard, and then he gets to tell his story. And then the doctor's able to still take notes, and there's parts of it where he's talking about how much he can remember. And that's really important with the dementia aspect of it, for the medical side of it, is how much memory is being affected. So with my dad, when I go talk with him and he tells me stories and we just talk with one another, I can tell how much his memory is fading. So he's been living in London for a year now, and I can tell that he used to be able to remember when I'd come visit, but now he can't remember. So oh, I saw you yesterday, and he'd be like, you did? So with that, it's important for him to be able to tell his story of what he can remember that day, because for the medical providers, it could be a really good indication of his memory and how much he has and even how much time he has. So just letting him speak and to tell it, and that neurologist was great. He was absolutely fabulous and was my favorite interaction among all the health providers that we had because he did that. he always talks about writing a story. So that's something that I really want to do with him, is that he'll always say, like, I just want to write things down and see if I remember tomorrow. So it's tests that he sets for himself. And so I'll find things that he's written, and then I'll just show it to him, but he doesn't remember why he wrote that or what was the purpose of it. So if I sit down with him and actually, do it with him, then that might be easier to do it as well. But he still does write. He writes me short stories, and when I come, then I read them, and it's really enjoyable because it's the long-term memories that he still has. So that's what he writes about.
Hi, this question is for Brent again. My dad was on dialysis before he died too, and my mom always said that she didn't want to go that route. But I guess my question might be, do you think it would be better if people were asked about having dialysis before it was actually needed, if they were given the choice to make that decision before it became almost like an ultimatum?
Yes, that's most definitely, I think, one of the things. It should be recognized that people with diabetes is that that some potentially could be one of the results of your diabetes, and it should be made known to people that if it ever came to dialysis, would you want it? I think that really needs to be communicated within diabetes education, renal education, as far as and putting it in layman's terms. One of the biggest pieces for communication for my mother was when they used that medical jargon on her. We mastered the art of what we would ask back, and we would say, okay, if we did this, what would happen? If we didn't do this, what would happen? And then it would make the doctor take a step back and say, oh, I never realized, it's, consequences. What are the consequences, right? And I think, people, for Indigenous people, they really need to know what the consequences of each action is. I mean, that's one of the things, that's how she understood things. If I did, it's like a kid, right? Not trivializing, but if I do this, what will happen? I mean, I still do that. If I press this button, what will happen? It gets me in trouble, especially if I'm in the hospital and some bell goes off. So I still do it. So, but yeah, just to add some humor there. But yes, definitely, education is key. Definitely, and it needs to be put in terms that people can understand what are the consequences of these actions.
I think we're going to take a couple more questions, and Loy, I know you've been waiting, so.
Thank you, and I want to thank our speakers for sharing those stories. They were really moving. My name is Loy Wiley. I teach at Western University and around healthcare and how to improve the way that we train healthcare workers to provide more culturally safe care. And when Danielle and I went on a visit to Anishinaabe Health in Toronto to ask them about that, and I asked the question to the executive director there, what's the key thing that we need to do to train health providers, new and up-and-coming healthcare providers, how to be good partners in such a workplace like Anishinaabe Health, where it's a team-based approach to providing an Indigenous-focused care. And basically his answer to us was humility, that people need to be willing to learn from anyone. And I think what you guys have demonstrated here is that was what was really important in your stories, was that people that were willing to hear your side of it and understand that that was an important part of the care journey. And the point I have as a question to you both is, I liked your comment of sometimes your choices are a bad choice and an even worse choice. And Danielle really kind of highlighted that in her story of, trying
not having culturally safe care in the mainstream healthcare institutions, and then Chippewa Rama not having enough resources to provide good care for your dad in his home community. And I'm just wondering, Brent, I don't know if your mom was able to access care in her community at all, or traditional healing, but what would be a good way that we can connect those and better have a coordination of care between those two different services, so that it can be the best of both worlds, so you can have the care that you need at the level you need, as well as it culturally safe across those.
The unfortunate part for my mother is that we lived in Peterborough at the time. So we were designated as urban Aboriginal people, right? And so the level of services that were available to her were pretty, pretty scarce. Because if we were living in our home community at the time, she would have probably received a home care, like a homemaker. But the fortunate thing is that, we became professionals at advocating for our own health. We went to different services as much as possible to, ask, and one of the great things I think was our saving grace was the social workers at the hospital. And the other part is that they opened a new hospital in Peterborough, and they had a spiritual center there, a spiritual care center. So when those times when things were bleak, we were able to go down to that spiritual care center and smudge. So we were able to do that. We were able to take her down there and do things like that. So it's definitely, there really needs to be a change in healthcare, how you approach it. That the doctor is doing his diagnosis. He's doing his job, right? But he needs help, right? And he needs the help of somebody that can be compassionate, that can be part of that. They say there are 4 parts of a being. Well, then for every patient, there should be 4 people standing there helping. One taking care of each part of that person. That's just my thoughts.
I think we'll have one last question, and then I'm going to make closing comments.
Oh no, so you're giving me the last question, Shannon? Oh dear. My name's Marlene. I work at St. Joseph's Healthcare. My question is around the complementarity of mainstream medicine and traditional healing. And so I don't know if you had any examples where you were perhaps thinking about sharing or trying to talk with your mainstream medical providers about traditional healing, and if that went well or didn't go well, and perhaps you didn't feel safe to bring any of that up. And so a related question is, if you have any advice, do you think we should try for more complementarity, and what might help with that? Or, am I just naive and we should just leave them siloed? You can tell me that too.
No more silos in health would be great. I think they could definitely be complementary. And when we've asked doctors about traditional healing, when my dad was still back home, we were dealing with mainstream services, and they would just tell you, why would you do that? That's not going to do anything. It's not going to help him medically. But of course we didn't listen, and you go, and it's fantastic. He's so happy, and he just feels so good. And so that's all that really matters, and that helps him. It completely complements his health to be a more of a whole person, and that he's connecting to those parts of him that he hasn't had most of his life. So they can definitely complement one another. There's nothing that should be stopping them. And I think that Brent put it beautifully, that you should have 4 people there for the 4 parts of a patient.
The emotional, the mental, spiritual, and physical self. It's a good question. It's again, it comes back to choice, right? I think healthcare system needs to be open to allowing that choice. A part of my story when I was talking was about that I had necrotizing fasciitis, so which is the flesh-eating disease. I had it. I went and did the surgery. They cleaned it. I had home care for that, and it was gone, supposedly. And then 3 months later, it came back. And this time, I went in, they did the surgery, they cleaned it, they fixed it. And this time, I went to my friends in Haudenosaunee country and said, I need help. They said, okay. And so we went through ceremony, and they put together some medicine, and they put together their own medicine to put on the wound itself. And within 2 weeks, the home care nurse that kept coming in, she said, you take this off when I leave, don't you? And I said, yes. I said, why do you ask? And she says, because whatever you're doing, don't stop. I said, okay. And we left it at that. That's when it came back, I had to do ceremony. I had to call in certain spirits and certain ancestors and certain, to come and help me. And I had to use natural medicines. And, and it worked. And it was complementary to what I was doing in the hospital, but I just didn't tell them. And that's because I don't believe they're open. But I have faith that things can change.
So I'll close us off tonight. I don't know about your lasting impressions, and maybe we can share some outside the doors over coffee and refreshments, but one of the things that I've just heard in many different ways now through the course of the night is these words about power and choice. And I think of the historical wounds and generational wounds of power that was abused, and of the importance that I hear as a healthcare provider about being very humble and acknowledging the importance that I come in a place of authority associated with the government, in a position of power to an Indigenous people that have been abused by all those things. And as I approach my next laboring patient who's Indigenous, I will be keeping that in mind. And I want to thank so much Danielle and Brent for their time, and all of you for your time and for your generosity in coming, and for the courage that's been in this room all night. Thank you so much for joining us.